The reason why I chose Jackson UM is for too many reasons. I really wanted a place that had the best collegiality possible, and I felt that the second I came onto this campus. On top of that, this is a 3-hospital system that gets pathology you can't even see in textbooks, and I knew that I would get the best clinical training experience here. This is an incredible place to learn and live.
We have private hospital, which is the UM flagship hospital. We have the county hospital, which is Jackson, and the Veterans Hospital. So the fact that we get to work in different institutions not only help us see different kind of patients, but also help us prepare to different kind of systems.
Overall, I think the program is just a great fit. It just attracts the best of talent, both from American universities, but also on an international level. I'm part of the Harrington program, which is specifically for people that come from Latin America and the Caribbean. The purpose of it as well is to essentially go back to your country and after the training, be able to practice what you learned.
When I graduate from residency, do want to be the best physician I can be. So being challenged by factors that are more realistic in healthcare, which is the side of business and economics, that challenge combined with medicine is what is so important about this institution.
The adequate amount of supervision that we have let us grow into this mind of actually not only diagnosing but managing patients.
The biggest surprise that I got when I came here was that I didn't realize this was the gateway to the Caribbean and to South America. This is the place where you can literally practice medicine in a global aspect without ever really leaving Miami.
I get to work like my 12 or however many hours a day, and then like when I have time off, I'm in a vacation city so I can get to mingle with the visitors and go to the beach, go to South Beach.
It's a city that continues to amaze, and it's constantly growing, constantly something is going on.
You will see diversity in your patients, but also in the people. If you like the big city or you like the more quiet suburbs, there's different facets of Miami that can appeal to any individual. So in terms of food, in terms of experiences, in terms of academics, you find everything here.
This program has an excellent clinical training. When I came here, I was expecting to find friends, but I found family. You have a great support from your peers and mentors.
I think of UM as my family. Since the first day, the community what we have is very important. The way that you can approach anyone, the faculty, the program director, your APDs or associate program directors, I really never hesitate to ask them a question, to shoot them an email, to text them. So there is a sense of familiarity here.
Being a resident here, there's so much support, whether that's in terms of wellness or your future academics. There's just so many people willing to help you and are geared towards advancing your own career.
Residency is really hard, and you have the best support system possible. When you leave here, you feel like you can take on the world. There's no patient, there's no diagnosis that you haven't seen, because truthfully, you'll see it somewhere at one of our 3 hospitals. So you feel very prepared to diagnose patients, to manage patients, and to really take care of them like they're your own.